Just heard there from the head of France's Scientific Council, who says he fears that there are 100,000 COVID-19 cases in France, double from what official figures show us. Given that the French government doesn't have a policy of widespread testing, is this a given that there are just so many cases in the country?
For the moment, we can say indeed that there is a lot of cases in the country. I don't know if there is more cases than during the spring, because during the spring we were not doing so many tests, and for the moment we are doing maybe 6 or 8 more tests than in the spring. So I don't know if there is more cases than in the spring, but yes, in my area we are facing a second wave more intense.
Okay, we have an intense second wave of the virus. The fact that I want to ask you about fighting COVID-19 right now, given what we knew from the first wave, are we able to treat coronavirus cases that end up in hospitals? Are we able to treat them better?
Yes, we are able to treat them better. We do not have any treatment against the virus itself. First, we thought that maybe chloroquine or maybe remdesivir or other old anti-HIV drugs could work. But finally, maybe remdesivir has a small effect, but not so much. So we do not have something against the virus itself, but we have something against the inflammation triggered by the virus. And we know now how to treat it in good time to prevent people from going to intensive care unit or from worsening their respiratory state. And when people need to be admitted in intensive care unit, the way people are cared is different from during the spring. We have learned a lot. We try not to intubate them, not to make them breathe with a tube, and there is less mortality. So I think that everywhere in the world we are doing better, but we do not have a treatment against the virus itself.
Can I just go back to this point you mentioned that you're not rushing to put people on ventilators? Is that because we're stretched too thin, or we have another way of treating them that's better?
No, because we are aware that making people breathe with a respirator may be bad for the lung. For other type of disease, for other type of lung infection, intubating people is the best way to take care of them during the maybe 2, 3, 5, or 8 days during which their lungs do not function. But for COVID-19, it seems that it's better not to put them under respirator. So we are not doing this because we are short of respiratory machine, but because we know that it's not so good for them. If we can avoid intubation, it's better.
Authorities in Europe seem to be doing all they can to avoid imposing a full-on lockdown to limit the spread of COVID-19. Can you realistically bring down the number of cases without a lockdown? Are nighttime curfews sufficient, given that people are still using public transport, still going to work, still end up in crowded areas?
Yes, it all depends on people. If people are going to crowded areas or going to work or going to meeting, but if they put their mask constantly, I think we can reverse this second wave. But if people go out, eat together, if they gather in family and seeing their parents or grandparents, I think that the cases will still rise, and maybe, yes, the curfew won't be enough, and we will need a real lockdown, maybe not in the entire France, but maybe in some area in Lyon, Grenoble, Lille, Marseille, or other town. But there is still a chance that we avoid a total lockdown if people confine themselves. They're still going to work, but they do not eat together. They do not see their relatives, and they put the mask on all the time.
Dr. Olivier Paulard.